Tropical cyclones and hurricanes can impact your health in some unexpected ways. Our Kristen Currie spoke with the American Heart Association to learn more.
As we get further into summer, two things we really watch for here in Central Texas: wildfires and potential tropical systems. So joining me today is Dr. Matt Ashley, who serves on the board of directors for the American Heart Association and is the chief medical officer at the Center for Neuroskills. How do those tropical systems maybe impact those with cardiovascular issues, compared to a normal person as well?
Hurricanes, like wildfires and others, can have an impact on air quality, and those same things that we've been discussing are applicable. Also, I think it's important for people who've survived stroke and maybe have disabilities to recognize that they're going to have additional needs in terms of preparation for those types of events. So making sure that they have their evacuation plans in place, making sure that their loved ones who may be needing to provide them with assistance are able and ready to do so. And then, of course, in addition to having the same types of evacuation supplies that most people should have in their homes, they may need to have additional supplies. For example, medications, medical supplies.
One of the things I thought was really interesting is there was a study done just now, and it said that cardiovascular disease joined drowning and injury as one of the top causes of death after Hurricane Katrina. I mean, that was back in 2005, but to see that risk, cardiovascular disease with injury and drowning from a hurricane, did that surprise you at all?
It's perhaps a little bit surprising at first, but when you really think about it, it makes a lot of sense. So, people who have ongoing chronic conditions related to cardiovascular health, they really require continuous support from our medical systems and from their environment. And when that's disrupted, it can have a profound impact. And then add to that the acute stress of the event itself on a system, an individual who's at risk, and it's just the recipe for some unfortunate outcomes. So, being prepared ahead of time and recognizing that is really the key in minimizing people's risk.
Dr. Matt Ashley, thank you so much for joining us today.
Pleasure, Kristen. Thanks for having me.